for a period of time. I think, a certain number of minutes. It wouldn't be if you just happen to pass them on the sidewalk or something, then you wouldn't get a notification. But theoretically, this would tell you if you were at risk, and if you needed to get a test and find out if you had been infected. However, the company has not been able to produce the software to actually do that. So they had a deadline to produce the contact tracing that would automatically notify users, and they've missed that deadline by, the last I read, it was 74 days, but it's more than that now. And they're not able to give users that information. Currently, they're reporting on locations that people have been in, from location data on people's phones, but they're giving that in a spreadsheet form to the departments of health, which can help if, contact tracer can call a person and say, well, I can see that if you've downloaded this app, I can see that on this day you were at this location and this location, to help jog people's memory so that they can find out, well, did you spend time with people who we may need to contact and see if they are infected as well. But it is certainly not this silver bullet of being able to find the people that you may have interacted with. And the state has spent a lot of money on this as well. And shortly after they created this contract, another company offered to provide some of this technology for free. I think it was a week later, another company offered to provide it for free. So this has been sort of a mess too, because no one has produced, Apple and Google haven't produced this technology either yet. So could it even be done? We're not sure. And then there's all kinds of privacy concerns that individuals have, which are absolutely valid, because who knows what, we do need to know what's happening to our data. This is an issue. But again, no bid contracts are, we need to be sure that people can fulfill the contract that they say that they can. Do you have thoughts about this one?
I have a question. If I were just a voter, and you can see that there's a contract established between the government and this company to deliver something, and now we see that the company has failed within a deadline to produce that. Does the state then have legal, is the state in a legal position to get that money back, or to not have to honor certain elements of the contract because essentially the company has broken the contract?
I am not certain about that, but I know that the state has gotten out of contracts where either the terms have not been met or the situation has changed sufficiently that it's simply not a good contract anymore. And we're going to talk about that in a minute. But not as a non-lawyer, I would say that yes, if a company doesn't keep their contract, then there should be a stipulation where the state can break the contract, and at least not continue to sink money in, because with the contact tracing app, there's a certain service fee that the state is paying to this company each month to maintain the system. And so because of course, if they're providing a service, they do need to be paid for the service that they provide. However, if they're not providing the service in the way that they said they would in the contract, then why are we continuing to pay? I would say that this is a good opportunity for you to contact your representative and say, what are your feelings about this, and what can we do about this, and have your representative be beginning to ask these questions, because they are responsible for the budget that's being spent on these contracts, and making sure that what is promised is being done.
Right. And then can I add something else then? So like, as a candidate looking forward to being a legislator, I feel like this is a really important lesson to just drill into our heads, which is everyone wants to come with that silver bullet contract that will, make all of the voters happy and will make us look good. And we as, government officials will be able to just save everyone. But we need to really kind of be leery of anything like that, because as people responsible for public funds, we had to do a much better job at vetting, much better job at oversight, and making sure that whatever we agree to do, we can honor, and that hopefully too those people who are contracting with us will honor them as well. But I can just imagine, like, you're sitting in a room with a bunch of other legislators and thinking, what can we do? We got to do something. And so easy to say, yes, you do that, yes, we'll do that, we'll throw money at you, we'll throw money at you too. And that's just really important for us to remember, like, to keep that in mind.
Yes, absolutely. And also, I think it's important. One of the things that's very important to me as a candidate is transparency in our government. Can we observe what is happening with things that are of interest to us, like taxpayer dollars or programs that affect us, and how forthcoming is the government with that information? Because we deserve to know what's happening with our business and our money. And also accountability. Is there something that can be done? Can we end a contract? Can we ensure that there is a better process next time?
I think it's also important to listen to your voters. I mean, who says you have to be in over a billion-dollar tech company in order to come up with a good solution to these problems? I think there could be people within your own district, within the state of Utah, that could say, you know what, I have this great idea. And just listen to people. Some may be a little far-fetched ideas. They may not be very realistic, but I think it is important that we converse about this and say, hey, we're working together as a team. It's not just, we're going to let the people in the Capitol take care of it, and then we get angry with whatever decision that they make that we don't agree with. But we really need to be invested and put forth our own efforts, I think, as well.
Yes, absolutely. So another, a sort of a similar situation, but with a slight variation, is the purchase and the contracts to purchase hydroxychloroquine. And there were actually two different contracts. There was, both of these have now been canceled, but the coronavirus task force contracted to get $800,000 worth of hydroxychloroquine available to Utah residents. And at the same time, the legislature was considering setting aside $8 million to be able to purchase the drug. And there was some confusion about, well, who are we both purchasing hydroxychloroquine? And then there was also the issue of, well, is hydroxychloroquine actually an effective treatment? And some of the drug that the task force had contracted was going to be specifically made to contain zinc, which is not normally included in the regular usage for malaria and anti autoimmunity issues that many people are taking hydroxychloroquine for already. And so this was sort of an unproven use, potentially an unproven combination, and then an overlap in the contracts. And also the $800,000 of hydroxychloroquine was many, many times per dose the cost of what would normally be paid for the drug. Just there were so many questions about these contracts as well. Now, thankfully, both of these were canceled once there was more information, and the money was not spent, and people were not given this medication. So, yes, Emily.
Yeah, sorry. I think that this particular thing, especially when it hit the news, the thing that stood out to me the most is the fact that the state auditor is it's a partisan position. And I really think it'd be great if we could make it nonpartisan, so that there is, I think it should be a nonpartisan position, so that we really can look at things and be able to feel that there's not, I mean, we can have more trust in the system of auditing. And obviously a lot of things do happen, and, mistakes can definitely be made as lawmakers are trying to solve the problem for the people. And I'm sure it's in the best interest that they're trying to act. But that's just what came to my mind, is how can we make the process a little bit more, like you said, transparent, not as much of that party line divide, if we were to have the state auditor be a nonpartisan position.
That's a great point. Yeah, because we need to be sure that the state auditor is representing the interests of all of Utahns, and it seems strange to me that a state auditor would have a political affiliation, a public political affiliation. Who is the state auditor working for? The people of Utah, not one party or the other. So, yeah, great point. That's very concerning. Yeah. Kate, did you want to say something?
Not particularly. I think
Okay.
I think you girls did a great job, is what I think.
Okay. Well, I want to talk about a few successes that we've seen in the state. First of all, I think that the local responses where the governor has indicated that, like, local counties, there can be a lot of variation across the state, where a rural county that doesn't have very many cases can be at a different level of risk than an urban county that has a lot of cases. So I think responding according to the specific needs of a place is really has been great. And related to that, we've seen a couple of local areas want to have different mandates for their areas that are slightly more strict than the rest of the state. And those orders have been approved thus far. So we've seen mask mandates in Salt Lake County and Summit County and Grand County, where many of our beautiful national parks are. And there's a lot of tourism that's really critical to those cities and towns there in that county. They have a request for masks to be worn in public indoor situations as well, to protect people and to ultimately, hopefully, protect the economy as well. So the ability for localities to have more control over their specific circumstances has been a great success. So, and I also have a few mixed success or not, and I'd love to hear your feelings on this. So first of all, in April, when we had a special session, the legislature passed a bill that would exempt businesses from liability if patrons or employees became sick at in their establishment. And this was only in the absence of, like, gross negligence on the part of the business. So if the business was being, like, reckless or willfully harming people, then they would not be exempt from lawsuits. But there was a feeling that you couldn't get businesses to open up if they felt like they were at risk of being sued for potentially being a place where people could become ill. So what do you think about that, about that law?
Can I share my experience from yesterday?
Sure.
Okay. I had this experience Monday. I choose to wear masks. I think it's important that I do. But on Sunday night, my mom sent me a text and said, "Hey, remember that gift certificate I gave you for Christmas? It expires on June 30th, so you need to use it. And your brother went and used it yesterday, so go." And I thought, can't pass up. I mean, I'm stressed, and I've been sitting in front of a computer for all of these months, and my back is aching. So, okay, I'll go. And I figured, just assumed that the employees would be wearing masks, right? Because everywhere I go, when I go to Smith's, I go to Costco, I go to get my tires changed or my oil changed. I go to the Snow Shack, and every single employee is wearing a mask. And I figured that's probably what everybody's doing. And then I went to this place, and right at the front, not a single employee. There were 4 girls at the desk. Not a single one of them was wearing masks. No, none of the customers were wearing masks. I was the only one there in a mask. And I thought, what is this? And I should have gone, because I was planning on going and helping my in-laws move to California. They're both older and could potentially be at risk. And we were planning on helping them move on Wednesday. And so I was thinking, well, I need to make sure that I'm safe, but I didn't leave. I assumed that when the masseuse came in, she would wear a mask. I assumed all of these things. And maybe if I was facing down, she was just breathing on my neck, maybe I'd be okay, right?
Germs don't travel down, right?
Exactly. Like the germs would just travel past me as I was looking down to the ground. That's totally what I was thinking. when she came in, like I was already unchanged and everything. And as she came in, I could tell she wasn't wearing a mask. And so I'm like, okay, maybe if I just don't look up at her, I'll be okay.